At Lifespan, we strive to deliver health with care through compassion, accountability, respect, and excellence. Our mission to fulfill these vital commitments is shown in three important ways: our connection to the community, the world-class care we provide, and the relationships we cultivate with our patients. Lifespan's presence in the community demonstrates that we are an asset to Rhode Island's future. Our commitment to the health and well-being of our community extends far beyond the walls of our hospitals and clinics. Through Year Up, Lifespan gives young adults who have limited opportunity and sometimes challenging circumstances job training, a chance for college credit, and paid internships.
The 6 months that I spent on my internship here were so amazing. The team, the company was just so amazing that I didn't want to go anywhere else. I was head over heels with Lifespan.
Over the past 10 years, Lifespan hired more than 50 Year Up interns for full-time jobs in information services, human resources, and healthcare operations.
What I found in my opportunities to interact with the Year Up interns is that they're no different from anybody else. They truly just want to do well in life, and oftentimes they're not afforded that opportunity. But once they are, they really prove that they can do well in the corporate world.
I feel just as grateful as I did the first day walking into the job for the opportunity from Year Up and Lifespan.
Imagine being a child and losing a loved one, a parent, a sister, a brother. It would affect every aspect of your life.
She doesn't even know that she ever had a brother.
Dealing with tremendous sadness and sudden life changes can be overwhelming for children and parents. But Friends Way is here to help. Friends Way, a program of Gateway Healthcare, helps families cope with grief. Friends Way is Southeastern New England's only child bereavement center. It provides a unique service and fulfills a role that is needed in the community. Families reaching into each new day. A place for helping and healing. The Lifespan Transitions Clinic is the first and only clinic in Rhode Island that provides primary care and support services to formerly incarcerated individuals with chronic medical conditions. Lifespan's community health workers, who also have a history of incarceration, help them navigate the healthcare system.
I decided to be a community health worker because I knew through my own experiences I would be able to connect with my community.
In addition to medical care, the clinic assists in managing the social determinants of health, including employment referrals, food and shelter, transportation, and mental health support. Participants like Lisa have experienced the benefits from this program.
They have been by my side ever since I've met them, and I'm grateful.
It's important for me to connect the people I work with medical providers, but it's so much more than that. When they see me, they see I can get that job. I can try to make amends with my children.
It's the best thing that ever happened to me in my life. Look at me, I'm healthy now.
I'm also the population I serve. I'm just the outcome.
At the forefront of academics, research, and innovation, we provide the very best medical options, thanks to our world-class doctors, nurses, and other clinicians.
Dr. Klinger is like one of the nicest people I've ever met. She's always like, "Hi, Lucky," and then she knows exactly what to do all the time.
Lucky is an active preteen, but increasing pain held her back.
And so she was just missing out on life, missing out on things that she loved.
Lucky's persistent leg pain and migraines had different doctors in the Boston area trying to identify the problem, but none were able.
Dr. Klinger was the first doctor to say, "I think I can help your daughter."
Dr. Klinger diagnosed tethered cord, a painful spinal cord condition.
As a physician involved in pioneering in this field, it's very important to understand what is the problem in tethered cord syndrome and also improving the outcome.
Dr. Klinga is willing to say, you know what, I'm willing to think differently, I'm willing to look more deeply so that I can help you, not just send you on to the next doctor.
After successful surgical intervention, Lucky is back to running around and being a kid.
She sees what other doctors don't see, and that's really cool.
Dr. Gökaslan, he is the best for this kind of surgery in the world.
Gökhan, a Turkish native residing in Los Angeles, experienced fluctuating pain in his lower back. He soon learned it was a rare, life-threatening tumor called a chordoma. While on a business trip in Turkey, he received news that his tumor was cancerous. Physicians there referred him to Dr. Zia Gökaslan, one of the only surgeons worldwide who performs this procedure.
I do specialize in the surgical treatment of these tumors. I tend to get a lot of these referrals, not only from the United States, but also from other countries around the world as well.
Dr. Gökaslan described my situation is very rare, 1 in a million case.
His tumor had an intimate relationship to some of the critical nerves. We were able to preserve them during the surgical procedure.
I just remember first time I woke up, it was like I'm waking up to life again. And then first time I saw Dr. Gökaslan again, I just wanted to hug him. I'm back in life. How can I thank him?
As he pursued his Olympic dreams of hammer throwing, high school senior Bobby Colantonio Jr. had leg pain that he thought would eventually go away. However, a doctor at the University of Alabama, where Bobby had accepted an athletic scholarship, gave this freshman news he never expected to receive.
They said, well, the best thing to do now is to just go home and meet with an oncologist back home.
Bobby was diagnosed with metastatic Ewing sarcoma, a bone cancer that affects fewer than 100 patients per year. But even with a survival rate of only 30%, Dr. Bradley DiNardo took an aggressive approach to this rare and deadly cancer.
He had a full body MRI that was scheduled for me that they don't really do on patients that are like older than 2. He found another site of cancer. They would have missed that if it wasn't for him.
Bobby's participation in a clinical trial not only offered him the ability to get the most cutting-edge treatment available, but also adds to our overall knowledge about Ewing sarcoma and pediatric cancer in general.
Now, Bobby throws a hammer farther than before he became ill.
I still think I can make a very, very good attempt in 2020 to make the Olympic team.
Alex Eisner is open about her love of animals, especially horses. But starting in middle school, she found it hard to hide her anxiety and depression.
I was having panic attacks at school pretty much every day.
She just got very, very emotional, but really couldn't express the way she was feeling.
Alex's despair escalated.
I started cutting when I was a sophomore in high school.
Alex and her family turned to Bradley Hospital, where she was treated in 4 different programs, all within a single facility.
Initial treatment focused on helping her resist some of her self-injurious urges and trying to find a way to reconnect her to things that she enjoyed. Going to college was the single most important element in her progress in treatment.
Every single doctor that I worked with told me that they wanted me to go to college.
Although Alex had missed 3 months of school for treatment, she stayed after school every day when she returned in order to make her college dreams a reality.
There are times when you feel like there's no hope, but there is, and there are people who want to help you, and at Bradley, all the doctors, they truly want to help you.
Our patients are at the center of everything we do. Extraordinary care begins with a trusting relationship between a care team and a patient.
The last thing I remember is pumping gas at the gas station.
As a nursing student, Natalie had just finished her clinical rotation at Rhode Island Hospital when her car was hit head-on, landing her in the same unit, only this time as a patient. After 1 week, she was transferred to Newport Hospital for recovery.
Everyone there was rooting for me or going out of their way to really support me, to the point where I honestly felt like I was the only patient on the unit. Dave was a great example of someone who gives care and is genuinely friendly.
Natalie was always very positive during all our therapy sessions and really was interested in learning from us as well because she was a nursing student and was interested in how she could help her patients in the future.
Natalie's time as a patient allowed her to see nursing from a different perspective.
So it really made me realize and empathize with my patients. I felt like Dave was an inspiration for that. He was so genuine.
For some reason, I just knew she was having a heart attack.
I told the rescue workers, take me to Miriam Hospital.
Mary's unexpected heart attack in 2012 led her to Dr. Joseph Loro at the Miriam Hospital. Even when her heart stopped beating multiple times, he continued to resuscitate.
Mary would not give up.
I could hear Dr. Loro the whole time talking to me. There was no doubt in my mind that Dr. Loro saved my life.
Every year in January, Mary sends me a card and thanks me for giving her this life back.
If not for Dr. Loro, there wouldn't have been that second card, or the third, the fourth, or the fifth.
Mary and Dr. Loro met again 5 years after her heart attack.
Your cards are very inspiring to me. I use your cards when I teach students so that everybody knows that what we do does make a difference.
Just know you're in my thoughts every day.
I do, believe me, I do. You've actually changed the way I feel about how I practice.
Without the use of both hands, I could never do it. I could never do this type of fishing.
Fisherman Dave Terrell nearly lost his hand after a serious boating accident in 2015. Orthopedic surgeon Dr. Christopher Gott saved Dave's hand and his ability to continue fishing.
We were going to cut it off right here the first night, but then Dr. Gott explained it to me that it's better to have a part of your hand than not have it at all. I'm glad I listened to him.
Dr. Gott had studied the procedure required for Dave's operation in textbooks. He was fully prepared, and Dave trusted him completely.
He's just a person that you would want to have as a friend and as a doctor. He became family. He's not only a terrific doctor, he's a great person.
I saw Dave every day for months almost, so it was a lot of time together. We went fishing, and we've stayed in touch ever since.
I don't regret it happening because if it didn't happen, I wouldn't have never met him.
You know, he's the salt of the earth. Like, you ask him for this shirt and he'd give it to me, you know, even if it was
I got a hat for you.
Outside.
No, it's like this one. Yeah.
I need it because I burn my bald spot now all the time. I got so thin the last few years. See what you did to me?
Well, I don't want to say nothing, but the glare is getting to me.
No one has better exemplified community outreach, world-class care, and inspiring relationships with patients than Dr. Michael Ehrlich, former Chief of Orthopedics at Rhode Island and the Miriam Hospitals, and Chair of Brown University's Department of Orthopedics. Characteristically warm and caring toward the children and families he treated, a respected leader, and always supportive of young trainees, Dr. Ehrlich stood out as a champion. His compassion and dedication to his patients shone through in this touching interaction.
We just had hope, and Dr. Ehrlich had hope with us.
He has been growing a bone, my fibula bone in my leg.
He's pretty smart. It makes me very excited that we could do that here in Rhode Island, here at Hasbro Children's Hospital.
He is the best doctor I've met.
Thank you.
He may be a fathead, but pretty sure he's got a big brain in there.
I think he's one of my favorite patients, even though he has a baboon brain. But even with that, I still love him.